What we're going to do is start with a PowerPoint to go through the key parts of the program and how to navigate through the Grants Gateway. Then I will log into the Grants Gateway. I'll show you how to find the grant opportunity and some information about it. And then I'm actually going to apply as an applicant and submit my application. So you'll be able to see kind of everything you're going to need to do once the application phase is live. So we'll get started here with Carolyn Garofalo.
Good morning. So thank you for carving out this time and being here with us. Just know that our goal today is to make this process as easy as possible. When you're applying, we provide many different tools, and I'll go over some of the opportunities you have to tap into help if you need it. And we're certainly here to keep this as streamlined as possible. So a few things I'll highlight for you that you should be aware of. The department, as you know, has posted the RFA in advance, so everyone has an opportunity to read through it, digest it, get an idea of what's going to be required of you as you apply. And today, obviously, we're doing our webinar. Our webinar will also be posted on our website. So if you need to watch this again, or if you have someone that you want to recommend the webinar to, as Jeff mentioned, it will be accessible on the website. You can watch that at your leisure. We also have a very important document that will be going up. It's our question and answer document. It tends to be long, but I would encourage you, if you have a question after today's webinar, to submit it to our email address, and we'll share that with you later. Even if you don't think you have a question, I would say review the Q&As anyways. When we get a question from one person, it tends to be a question that five other people also have. So if you read through it, you may find information that you didn't know you needed to know. Also know that within the RFA itself, if you've had a chance to look at it, we have customized directions on how to apply for a Grants Gateway account, specifically for individual physicians. So we know that we are one of the few grant opportunities that have individuals applying, and so we've provided that individual customized directions to walk you through. And the help desk at the Grants Gateway are fantastic as well. So if you're applying and you have a question about the gateway and how to navigate it, they're here for assistance as well. Finally, one of the very unique things about this grant that most other grants do not do is that we will help you throughout the application process. So once you submit your initial application, we have a team of reviewers that are going to go through your application and look for anything that might be missing or any issue where we might need additional information from you, and they're going to reach out and ask you for that additional information. That's very unique to this particular opportunity, and so make certain you're checking your email inboxes and that you're staying in touch, because if we need something for you, we will be very forthcoming with what we need. Again, as an closure, we'll just let you know that the Grants Gateway team is here in the help desk as well as you begin to get your account, and if you have not already done so, I would recommend you do so as a first step. So, getting into the program background, I'm going to walk you through a little bit of the RFA and the really important points that you need to be aware of. So, a little bit of background. Danny has been around for a number of years. Its initiative includes programs designed to help train and place physicians in underserved areas. The physician loan repayment and physician practice support programs make funds available to recruit and retain physicians. So we're really looking to have new individuals enter into these specific geographic locations. And all funding is provided in exchange for a physician's commitment to work in an underserved area for a 3-year period. And that is set for all grantees. The key dates that you need to be aware of are here on this page. First, if you have questions about the RFA, about the application process, you should get them to us by February 20th. And the best way to do that is through the email inbox. The answers, the questions, and all the answers will be posted for everyone to see on February 27th. And that document will reside on our department website, and it will also be linked to the opportunity in the Grants Gateway, so you can access that document in either location. And again, I would encourage you to read that because it really does have a lot of important information. So between now and March 5th is really your prep time to get all your information together, ask your questions, and the application opens on March 5th. That is the first day you can click submit and send your information to us. Now the Grants Gateway opportunity will be open until March 2nd at 4 o'clock.
April 2nd.
I'm sorry, yeah, April 2nd at 4 o'clock. Please do not wait till the last minute. There can be issues with waiting until 3:50 to click submit and your application's not going through. We encourage everybody at the very least to submit 24 hours in advance of that date and time. So mark that on your calendar because the gateway will close at 4 o'clock. So if you try, the actual submit button will disappear. Again, submitting questions, this slide contains the address to where you would submit your questions to. So before February 20th, all questions should come to dana2018@health.ny.gov. And now those questions will come directly to me, and I will be the one compiling them for the final documents. After February 20th, if you have any questions about the RFA, we are not able to address them. The only thing that we can assist you with after that time are technical questions. So if you're having trouble logging onto your account, if you're having issues specifically with the Grants Gateway, we're able to help you navigate that program. But specific questions about the opportunity, we will not be able to address. The Q&A document will go up on or about February 27th. So again, look for that and please review it. The reason why we do not respond to each applicant individually is from a fairness perspective. We want to make sure that every question that is asked is answered and shared with everyone. So you will not get an email back from me answering your specific individual question. You'll have to look for it on the Q&A document. So who may apply? Two types of applicants for this opportunity. First is individual physicians, and the second are healthcare facilities. And there are 4 types of healthcare facilities that are eligible: a general hospital, DPNC, or nursing home licensed by the department, a facility certified but not operated by the Office of Mental Health, a facility certified but not operated by OASIS, or a private medical practice registered in New York State as a PC or a PLLC. And if that is the category that you're applying for, please take note that you must be either a PC or a PLLC. We've had some individuals apply who are just LLCs, and the state cannot do business directly with an LLC. So you must identify yourself as a PC or a PLLC. Excuse me. The applicant is the person who will be holding the Grants Gateway account. So whoever registers in the Grants Gateway is actually the entity that is applying for the grant. So if a healthcare facility is entering the application, it's the healthcare facility we'll be contracting with, not the individual physician. We have a lot of questions surrounding that particular issue. Use of funds. We're a lot of options here. The most frequented use of funds tends to be to repay qualified educational debt. However, we also provide the funds to support a physician to establish or join a medical practice. And the funds can also be used to help healthcare facilities recruit or retain a physician. So, for example, providing a sign-on bonus, enhancing someone's compensation so that they remain or are attracted to the underserved area. In all cases, 100% of the funds must ultimately be distributed to the physician or the physician's practice. So again, we've had a lot of questions surrounding this, but the funds cannot be an offset. So the meaning of that is a facility or employer should not reduce a physician's compensation package as a result of getting a Danny Award. The Danny Award is meant to provide additional funding to a physician above and beyond what would have been provided to the physician prior to the Danny Award being existing. So again, it's meant to be an above and beyond enhancement to your compensation package. Application limits, they're a little bit different this year for those healthcare facilities who are applying, and we'll talk about that a little bit here. For individual physicians, you can submit one application. So if in error you start one application and the system will allow you or could allow you to start a second, we are only going to count the first application that you submit to us. So just be careful, and if you have issues where you've started a second application in error, just call the help desk. They'll walk you through how to fix that. But each individual physician should have one application sent to us. For facilities, they can submit up to 4 applications, and this is an increase from last year where they could have submitted 3. How we differentiate a healthcare facility is by your operating certificate number or your Department of State identification number. So we'll ask you to submit that number, and then we'll be certain that there's no more than 4 applications coming from those numbers. If a facility tries to submit a 5th application, the Grants Gateway won't let you do it. It'll lock you out. So there's a safety mechanism there. Award limits. So no more than 3 awards will be made to support a Danny service obligation to be carried out at a healthcare facility. And again, a healthcare facility is identified by the operating certificate number or the Department of State number. And I'll provide you with an example of this in the next slide. But the award limit will apply regardless of whether the application is submitted by a physician or a healthcare facility. So there's a difference between submitting applications versus how many awards that we give. So the next slide will spell this out a little bit more clearly. So, for example, Dr. Smith, who works at XYZ Hospital, submits an application. In addition, XYZ Hospital submits 4 applications of their own for their facility. So in total, there are 5 applications from XY facility submitted to the department. Since no more than 3 awards will be made to support a Danny service obligation at XYZ Hospital, the first 3 applications we get will be the ones that we review and consider. So some of you might ask, well then why would a facility even want to submit a 4th if we're only going to accept up to 3? If you look at the next slide, this is new for cycle 7, but the department may consider a 4th award at a healthcare facility under the following circumstances. If all eligible applications have been funded and there remains additional monies available, then we will go back and take a look at that 4th applicant and consider them for the award. So again, if we fund all eligible applications and we have money left over, we will go back to previously submitted applications and continue to give out awards until all monies have been spent. So it's really an opportunity for us to ensure that we have the maximum effect, and that if we have monies left over, we can go back and continue to make awards. So what are the award amounts? The RFA will provide the following: up to $40,000 a year for 3 years on behalf of a physician who agrees to practice in an underserved area for the 3-year Danny service obligation period. And again, underlining a 3-year obligation. There's up to $9 million in total state funding for this opportunity, and we anticipate approximately 75 3-year awards. The next slide tells you some of the award limits that we have to make certain we adhere to as we make awards. So no less than 50% of the funds allocated must go to obligations that are in general hospitals. No more than 5% of the funds allocated to obligations in facilities certified by the Office of Mental Health, and no more than 5% of the funds allocated to obligations in facilities certified by OASIS. So these are all limits that we as a department adhere to, but it's not anything that you need to be concerned about as an applicant, but you should be aware of. And the graph also shows that our funding is split up between those grants that we give in New York City, which is 1/3, versus the rest of the state, which is 2/3. We really try to take the entire state of New York into consideration and ensure that our awards are dispersed accordingly. Some important dates that you should be aware of. So the physician who is being named in the grant opportunity cannot have worked in any underserved area prior to April 4th, 2019. These dates are changed with every cycle that we release. The time, if you spent time as a resident or fellow, that's not taken into consideration, so that's important to note as many of you are coming out of your residencies and applying for this opportunity. The physician cannot have an employment contract or business plan at the healthcare facility or practice that begins earlier than April 4th, 2019, or later than November 1st, 2020. And that November 1st, 2020 is the start date for every single awardee. Again, all grantees will have the same service obligation dates. So everyone will start on November 1st, 2020, and they will complete their obligation on October 31st, 2023. So there is an important exception to note. Physicians who were named in the Cycle 6 application process and their application was either waitlisted and they were not given an award, or they were disapproved, may submit a new application for consideration in this cycle. If you're one of those individuals, then the dates reflect those that were first announced for Cycle 6, meaning physicians cannot have worked in any underserved area prior to June 13th, 2018. And the physicians cannot have an employment contract or business plan at the healthcare facility or practice that began earlier than June 13th, 2018, and later than November 1st, 2020. So what we're trying to do is to look back at anybody who might have been waitlisted or disapproved and had just a minor error in their application, something that we're giving them the opportunity to have corrected and then reapply for this cycle. So the Grants Gateway is perhaps the biggest question that we have. We are mandated by the state to have all applications go through the gateway. We cannot accept any paper applications at this time. So anyone with a potential interest in applying for this program, you really should start the process of applying for your own account now. Again, we have customized directions in the RFA for individual physicians that walk you through how to fill in the fields, what types of documents you need to support, supporting documents you need to submit, and we have the number for the Grants Gateway Help Desk that will walk you through that application process. But getting an account is something that can take several days, if not a week or two. So you really want to get moving on that right away so that when the opportunity opens in the gateway, you're able to apply on day one. And I really can't stress this enough, that you really should start now. Again, the process, we're trying to make this as easy as possible, letting you know in advance that we're giving you some buffer time to get started. So get your application in and complete it, and hopefully we'll start to see your applications roll in promptly. And at this point, I'm going to turn it over to Jeff. He's going to talk a little bit about the gateway, show you how to navigate in and out, and some of the fields specific to our grant opportunity.
Okay, thanks, Carolyn. All right, so as Carolyn just talked about, registration. That's really the first step in the Grants Gateway. You or your organization may already be registered, and that's fine. You don't have to do it again, but let's just talk about people that maybe haven't been yet. So all entities and individuals that wish to apply for grants in the state must be registered in the Grants Gateway. And this process includes filling out and mailing to us a signed and notarized registration form. So when Carolyn said it could take a couple of days, what takes a few days is Obviously, getting that filled out, which should only take a half hour or 20 minutes, it does have to be notarized, though, and then you have to mail it through regular mail to us. And then it takes us a couple days to get you registered, and I'll explain about that as we go through here. So individuals and organizations will both fill out the same form. There's not a different form for different types of entities. There's just a different checkbox you would check. And we have two places where you can find the form. I would go to, first of all, the Grants Management website, grantsmanagement.ny.gov. From the main page, you'll see a link that says Get Started and Register Your Organization. And of course, if you're an individual, think of it as an organization in respects of the gateway. And then at the Grants Gateway itself, which is grantsgateway.ny.gov, the registration form is there as well, which I'll point out. But I would start with the Grants Management website. So the form, if you don't already have an SFS vendor ID, that's the statewide financial system, that's where we start. So in the form, you're going to be, or with the form, you're going to be providing us that registration form, which is completed and notarized. And then if you don't have an SFS vendor ID, this substitute W-9 form. Just ask a few questions, really ask for your Social Security number or your federal ID number, and that's what we use to give to SFS to obtain you this vendor ID. And that's really where we have to start. And that's the thing that could tack on 2 or 3 days to getting you registered, because we send it to SFS, they get it registered, and then send it back to us. And then it's not until the next day that we can actually import you into the Grants Gateway. Another thing we want you to provide is an organization chart if you are an organization, or your resume if you are an individual. And too many times I see registration forms get mailed to us and they don't have the substitute W-9 form, or they don't have the resume or organization chart, and then you're tacking on another day because we're going to email you and say we cannot get you started until you send us this information. So just remember those 3 things that you have to provide. The registration form itself, signed and notarized, the substitute W-9 form, if you need an SFS vendor ID, and the org chart or the resume. So just a point for individuals, the form is asking you for your federal ID number, and if you're an individual, that means your Social Security number. Just to let you know, this is secure. What we're doing is when we take it down, we are just using it to get the SFS vendor ID, and then we are blacking out your Social Security number on the form, and in the gateway, it'll be just your last 4 digits. So pre-qualification is another thing that only not-for-profits have to worry about. And that's essentially the process where we verify that your organization is a well-run not-for-profit. There are certain documents and forms and policies and procedures that not-for-profits have to have in place in New York State, and pre-qualification is our way of checking that you're doing that and making sure that, again, you're a well-run not-for-profit. Okay, so again, all not-for-profits have to do this, and you must be in the status of pre-qualified prior to the application due date, that April 2nd date. So I'm not going to go through that in detail right now, but again, there's information about it on the Grants Management website. And like I said, your organization must be pre-qualified by the date and time that the applications are due, so April 2nd at 4 p.m. Your status must be in the status of pre-qualified or pre-qualified open. And as I mentioned, individuals do not have to worry about this. This is only for organizations, so you won't even have the option to deal with it if you're an individual, so don't worry about that. Another thing that's important is the grantee user roles, and this can confuse people, so I do want to spend a couple minutes on this. When we first sign you up, you fill out that registration form, and you're giving us 1, if you're an individual, or 2, names for the grantee delegated administrator. That's down here in the bottom left. And that's the person who can add or edit user accounts, manage pre-qualification, if you're a not-for-profit. So this role is created for all organizations and individuals. This is your main role. But notice what it doesn't say here is that this role cannot work on an application. So if you want to work on an application, you have to have one of these other roles. First of all, there's the grantee role. So a grantee can start and save and edit an application, but they cannot submit the application. So if you're an individual, there's no point in setting up a role called grantee because you wouldn't be able to submit it anyway. But if you're an organization, you might want to have a grantee because maybe that's your grant writer, and you have somebody working on the grant itself, but that's not the same person that's actually going to submit it. And that's fine. You can set up this grantee role to do that. But an individual or an organization must have one of these roles on the right. They both pretty much are the same, so I would suggest the grantee contract signatory role. That role has all the grantee abilities, so they can start an application, sign and save an application, but they can also submit it, and of course, that's going to be important to submit your application on time prior to the due date. So there must be somebody in this role for every organization, and individuals should create only this role and don't worry with any other roles. That other role would be grantee system administrator. So yeah, this person can submit the application. They can do all those other things that the grantee could do and the grantee contract signatory could do. There's a few other additional administrative abilities they have as well. All right, so again, an individual, you're going to be set up as a grantee delegated administrator. First thing you need to do is set up the grantee contract signatory. A couple more notes about it. Your organization must have that user in a role that can submit the application. Again, I suggest the grantee contract signatory, but you can also use grantee system administrator. It's certainly acceptable for one person to have multiple roles and thus multiple accounts. If you're an individual, it's obviously going to happen because you're going to have that delegated admin role and you're going to have that contract signatory role as well. You can set it up to use the same email address, even the same password, that's fine, but you do need a new account for each role. So you will have 2 accounts in most cases. Individual physicians should create 1 new role for themselves, and like I said, now for the 3rd time, they should be the grantee contract signatory. Okay, this goes back to Carol for the review and award process. Now, let me just mention, I'm going to do all that stuff that we just talked about, but I'm not going to actually create roles. I'll be in the role of grantee contract signatory when we get started.
Okay, so I'm going to take back over, dive back into a little bit about what happens on the back end on the review and the award process, some of the things that the department does, so that you understand how your application is being considered. So the department will review applications in the order that they're received in the gateway. So, and in addition, we'll notify the applicant via email if the application is complete or incomplete. This is a very unique feature of this particular grant opportunity. It's something that we do for Danny that is very important. We take a look at your application and we help you really walk through it. We hold your hand so that if what you provided to us was not complete or unclear in any way, we'll work with you on it to get you through the completion stage. So for example, if the application comes in and it's complete, no further action is going to be necessary on your part as an applicant. Your reviewer will send you an email letting you know that your application is complete, and then you're just going to sit tight until we start to announce when the awards will be made. Your reviewer is really going to be very important to you, so when they reach out, please be responsive to them. Please read the emails that they're sending you. If your application is incomplete, you're going to get from your reviewer a list of outstanding items that we need you to provide. You'll have one opportunity and only one opportunity to submit this missing information via email to the department. So your response does not go through the gateway. Your response goes directly back to your reviewer, and you have 10 business days to review that list and provide the missing information. Again, all the correspondence will come from your reviewer, but they will be using the Danny 2018 inbox, and the department will not be able to accept any late submissions. So it's very important that you check your email throughout the process. If you're going to be going out of town, find a way to ensure that you can at least check your inbox, because if we reach out to you, that starts the clock of 10 business days for you to respond. And again, the reviewer is going to provide you with a bulleted list of everything that's needed. Please review it and provide a response in one email. We don't want to get one email with answers to questions 1 and 2 and another email with answers to questions 3 and 4. It becomes very complicated in this process if we're receiving multiple communications. So just respond once with as much information that's being asked for. Again, the deadline is April 2nd, 2020 for all submissions. And the evaluation process, what we do behind the scenes, is going to take us from April to June of this year. So funding decisions will be announced sometime in late summer 2020. Everyone will get a response. So when we make our decisions, you will be notified whether you receive award, whether you're waitlisted, or whether you are declined. All contract start dates will be the same for every grantee, so be prepared to start your service obligation on November 1st, 2020. So payments and reporting requirements, we have a lot of questions around this process. So you know, your contract will start November 1st, 2020. It does not mean you get a payment on November 1st, 2020. So we need to ensure that you're providing the service for a period of time before the first payment is made. So to go through the checklist, no advance payments are made. No payment will be made before the contract is executed. So typically, physicians must work for 3 months under the terms of the Danny contract before a first payment is made. That's an estimate. Again, we try to time our payments accordingly with our fiscal budget cycle, so we're giving you kind of the soonest that you would be able to get a payment to you. And again, we will communicate to you. The payments will be made quarterly or semi-annually. And you'll be notified that payments are starting to happen because you'll get an email from our department asking for employment verification. And that employment verification is signed, obviously, by the employer to verify that you have been working in this position named within the grant. Once that form is signed and returned to us, then payments will start to follow from there. In addition, as we go forward, not only will we continue to ask for the employment verifications, but we will also be asking for statements from your loan provider showing that you have applied the funds that have been distributed to you to your loan balance. So keep in mind that we'll be asking you for those statements as well. The next is a list of the attachments that are asked to be provided with your application. There are 10, which may sound daunting, but the first is the New York State Grants Gateway Vendor User Manual, which is very lengthy, several pages. It's there for your reference. So you don't actually have to do anything with that, but it's something that you can read. If you're having trouble, please defer to that. We ask for information specific to your site. If you have 4 or more sites where you're working, that would be attachment 2. We are going to ask for a loan statement. If you are applying for loan forgiveness, we want to see the statement from your institution, which would give us on that form not only your name, but the current date and the outstanding balance of your loan. And then we will look to verify that from that statement. There'll be a consent to disclosure. That consent gives us permission to investigate your student loan and make certain that it is current and not in default. You can be in forbearance, but we want to make certain that the grant itself or the loan itself is not in default. And we also want to make certain that the balance is verified. Number 5 is an employment contract or business plan. We need this from everyone. So we're going to ask you for something, if you have an offer letter or a copy of your contract that lists you in the position that you'll be fulfilling, dated and signed by the employer and the employee. In addition to that, and we'll talk about this a little bit later, there's an addendum that we will be asking you for, because not every contract is the same. And so we ask for an addendum so that we're getting the same information from each individual applicant. Number 6 is how you're going to identify that you are in an underserved area. We'll talk a little bit about that. Rural counties and towns, we'll defer that conversation as well. 8 is where you're going to upload all the information explaining that you have that you're in an underserved area. And number 9 is important again for everyone as well. It's an attestation and lets us know that you're cognizant of everything that's taking place, that you're willfully giving your information, that if we have questions we can ask, and it's just a formality that we need from each individual applicant. Our goal here is to make this process as easy as possible. So the questions that we ask you in the gateway are very straightforward. They're yes, no, short answer. And the attachments, we've tried to make them as clear as possible. I'm going to delve into attachment 6, which we do get a lot of questions about. It is the longest attachment, and it provides the most versatility for applicants in responding. So we provide you 3 options, A, B, and C, different ways to verify that you indeed are in an underserved area. There is no advantage to doing one over the other. They're all treated equally, so please choose the one that applies to you directly. So for example, if you're going to choose option A, that means you are a primary care physician or a physician in psychiatric services. So primary care would cover general internal medicine, family practice, general pediatrics, geriatrics, and OBGYN. If you're any one of those, this is the option you would look to first. We want to see if you are working in a HPSA, a MUA, or a MUP, and the way that you would clarify that would be to go to the address listed here, and on that, or in that address, you'd simply type in the address of the facility of where you're working. It will produce a page back to you that lets you know, yes or no, you are a HPSA, MUA, or a MUP, and you simply print out that page and provide it to us as proof that you are. So that's very straightforward. It's probably the easiest method to take. Option 2 is option B, rather. Option B is equally as straightforward. Again, you would be a physician who is in primary care or psychiatric services. This time we're looking to see if you work in a rural county or town. And the state provides a list of counties and towns they have identified as being rural. And we've provided that list to you in attachment 7. So you can take a look at that list. If the location where you're working is noted there, simply circle the location on the list and send it back to us as proof that you're in an underserved area. Option C is the most lengthy, and it does apply to anyone who is a specialist. So this is where you would focus if you happen to be an orthopedic surgeon or in endocrinology. So we provide a list of 17 questions, and you must be able to answer yes to 6 of them. Please answer every single question. So if your answer happens to be no to any one of the questions, just note no. What we're looking for is that the fact that you read all 17 of them and that you were able to answer yes to 6. Now, to clarify, this is not just for specialists. So if you're a primary care physician, but you're not in a HPSA and you're not in a rural county or town, you can also use this as a third method to verify that you live in an underserved area. So anyone is eligible for this particular option C. What you're going to do is print out that list of questions. You're going to mark yes or no to all the answers, and then you're going to provide the necessary backup documentation that we ask for. So some questions do not ask for backup documentations, others do, and they'll tell you exactly what we're looking for. Take everything, the questions together with the backup documentation, and upload that as your response to us as one giant document. So the program-specific questions are the questions that you're going to answer directly in the gateway. Those questions are listed in the RFA, so you know in advance what they are. You might want to read through those questions, answer them on paper, so that when you get to the gateway, you're just transferring your answers in. But again, most of them are yes, no, and short answer. There are no trick questions. We're trying to make this very straightforward and very easy. And then the one important thing I will note that some healthcare facilities neglect to do in this particular section is name the physician who's going to be carrying this grant. So if you're a healthcare facility, please know that when you apply, you have to have a physician in mind for this grant, and you must name that physician. So that's something that is often omitted, and we have to go back and clarify with the healthcare facilities. that you can't just submit an application and choose to fill that position name in later. It has to be done at time of application. I think we're good. We're going to move on to the very next slide. There is a work plan within the gateway that you have to complete, and we've tried to pre-fill a lot of that information in for you so that you have to do minimal work. So the objectives, the tasks, and the performance measures are already in there. They're things that can't be changed or removed, so they're technically already done for you. Just read them, be aware of them, but there's no action that you need to take with them. In the summary section, we do need you to enter some information into that particular section. The information that you're going to enter is pretty standard. We're looking for the contract period, which again is the same for everyone. It's November 1st, 2020 to October 31st, 2023. In the project summary area, we're looking for, what are your counties of service? So we know where you're practicing, but what counties are you servicing within that practice? And also asking you to name the medical specialty that you're practicing. Where it says organizational capacity, you don't have to enter anything, but you have to enter an NA, I guess. You don't have to enter content, but you have to enter the words NA, because if you leave it blank, it won't let you save the page. Okay, that is very brief, and now your work plan is done. The next section to take a look at is the budget. And the budget, again, we've tried to make it very limited in what you need to enter. There are two methods. The first being if you're applying for qualified educational debt reimbursement, which will be the majority of the people probably listening in. If you look at the graph, on the left it shows the fields in the gateway, and on the right it shows what you need to enter into those fields. So it can be verbatim. When it says expenditure budget, you're going to type in repayment of educational loans. When it says narrative, all you need to put in is repayment of educational loans. The total grant funds that you're requesting, you need to put that in that particular field, which will not be the same for everyone. You cannot request more than $120,000 over 3 years, but you can request less if you do not have that much debt outstanding. And in the other narrative section, you're going to list, basically you're going to take your total request, which could be $120,000 for 3 years, and say what the individual amount, which would be $40,000 a year for 3 years. So you're going to just simply type in the content that is there. It's very straightforward. And please remember to save frequently. You'll see that little note on the side. But the gateway has a quirk that if you're not saving your pages frequently, you can lose your content. So if it's taking you a while to complete, just go up, hit save on the page so that you don't lose what you've already entered. The second type of budget is if you're requesting something other than money for outstanding qualified educational debt. Half of the fields will be the same. The first two fields will be different, where it says expenditure budget and narrative. So for the expenditure budget, we're looking for, if you're an institution, perhaps you're a private practice and you're asking for money to recruit and retain a physician to that practice or to expand your practice, we're looking for you to name the individual relevant budget items that will be applicable to this particular grant opportunity, and I believe we'll kind of look at that a little bit later. We'll show you an example. You can select more than one. There's an add button, so if you add the first one and add the second one, make sure you're saving in between. The narrative means just give us a justification for why you want to use the money in that category. What is it going to be used towards? And the last two fields are the same. The content there I will not read through with you, but it's pretty straightforward. We'll spend a little time talking about default provisions because we do find, unfortunately, that some grantees are not clear on this, so we want to be very clear at the onset. So at the time that we award you your contract, you will be notified of the source of your funding. Your funding could be either state funding as 100%, or it could be a combination of state and federal funding. And the default penalties are different depending on where your money is coming from. The formulas are listed in the RFA on how you would calculate what your default default would be. It's not up to you to arrive at that number. It's something that we work with grantees on should this situation arise, but we will stress heavily, the default penalties are very severe. Please, as you're submitting your application, go into it knowing you're going to stay at that facility for 3 years, the total commitment period. If you default, you will end up probably paying back more money than you've applied for. So I know that's not clear to a lot of people. We want to be very clear. Again, we will talk with you if you run into a problem with your grant, if you are, and we'll go through some scenarios later on, but please go into it thinking that you're making a 3-year commitment, and be aware of the formulas that are listed in the RFA on how your default would be calculated if you do not finish those 3 years. A lot of people are surprised at default penalties, even though we try to highlight it as much as we possibly can, but they are there, and then we just want to reaffirm that to you now. On the next page, the penalty for default is assessed against the person who holds the contract. This is very important as well. So if you are an institution and you are applying for a grant for a particular position, and that position leaves your employment, the institution is who is the penalty is levied against. So it's always the individual who holds the Grants Gateway account and who holds the contract. So if you're an individual physician applying on your own and you find that you're in default, we would contact you directly about your default. If it's a healthcare institution, we do not contact the physician, we contact the institution regarding the default. There can be various reasons why you may find that you're facing a potential default. I would encourage you to contact the department if there's any degree of concern, and we can counsel you on what your options are and what your penalties may or may not be. If a healthcare facility applied for a Danny Award for one of their physicians, and the physician leaves prematurely, it's the hospital who would be responsible for repayment. Healthcare facilities may consider conditional clauses in their contract with a physician to address any concerns regarding Danny default provisions. So that's something that we want to make healthcare facilities aware of, that is really on you to pursue that option if you so choose. Healthcare facilities may also request to replace a physician who leaves the hospital with another physician so that the grant can continue. The grantee would need to contact the department and let us know that this is something that you want to do. We would speak with the healthcare facility to determine if that replacement physician is eligible, and we would work with you through that process. The department ultimately holds the ability to make that decision on if that physician is an eligible physician or not. So modifications. It is the sole discretion of the department to approve the following: a change in physician service location. So this happens sometimes for individual physician applicants who start their employment at one location and within a 3-year period find that they have to move to another location. They may take that grant with them. However, they would need to contact the department in advance, and we would need to screen the new location to make certain that it is in an underserved area before we would approve that change. There's also instances where a physician might need to defer their service obligation. Such instances might be that you need to go out on FMLA for having a child or a healthcare need. We will work with you on that. Let us know what the situation is. We can put a pause in your service obligation, start it back up again in 6 months, and we would just extend your end date by that time. So it's not uncommon that people have children during this 3-year period or have other challenges that require them to take a deferment, and we are flexible in working with you on that as well. But just let us know prior or as early as you can that that situation is taking place. Tax issues. We are not tax professionals, so we will tell you to contact your tax professional professional for advice on this particular situation. However, we do know that currently funds used to support loan repayment are currently exempt from federal and state taxes. So you should not be issued a 1099 form from us. Funds used for purposes other than loan repayment, so for bonuses or retention bonuses or performance bonuses or recruitment, they are not tax exempt. So, there is differentiation in how those funds are being used. But the laws can change at any time, not anything we have control over, so please consult your tax professional as you are preparing your taxes. Other scholarships and loan forgiveness. So our key points: no other state or federal loan forgiveness obligation can overlap or coincide with the Danny service obligation. So if you have an obligation that starts and ends before the Danny service obligation period, or one that takes place after, that's fine. But we can't have one that coincides at the same time or overlaps in any way. The only exception is the Federal Public Service Loan Forgiveness Program, which many of you are also participating in. That's a very unique situation that we'll discuss in greater detail. Also, if the physician has previously participated in our Danny program, that person is not eligible to reapply. So you're only eligible to participate in our program once. So a little bit about the Public Service Loan Forgiveness Program, which many of you are interested in and pursuing. We know it's a 10-year obligation. The grantees who are given a Danny grant are only required to make the minimum payment toward their loans during the time of the contract with us. So we're not going to require you or disadvantage you by asking you to pay advance monies back to this program. We will say continue what your monthly payments are to the Public Service Loan Forgiveness Program and use your Danny funds to cover those payments. But you may find that the Danny funds cover a longer period extending beyond the 3-year life of the grant. So what we will do is when we get your loan statements, we'll assess how many years you are into this commitment and what your monthly payment is. What we're looking for is that by the end of the Danny contract, that anyone within this program will have to eventually apply all their Danny funds to payments in the Public Service Loan Forgiveness Program. So again, the statements that you give us over time will show us the payments that are going in. You'll have to demonstrate that all monies are applied to the program because it is a public health law that our funds can only be used for loan repayment. Okay. We talked a little bit about having a copy of a contract from every applicant or every physician. In addition to a copy of the contract, we also are asking for an addendum letter. So it's a 2-point ask. And the addendum letter will spell out everything that it needs to say. Please read that carefully. Please include every single bullet item. Don't give us 5 out of 6 or 2 out of 6. Give us all the statements we're asking for. This is an area during the review process that we have to go back oftentimes and ask for an updated addendum letter. That can be time-consuming for you because it's something that your employer needs to sign, and I'm sure as an individual physician, you're not going to want to have that asked twice. So make certain that it's comprehensive and that the form comes back to us with every bullet point and that it's duly signed by the physician and also the employer. Okay, so the last slide, we're just going to review a little bit about,
So hold on, I added one slide here. So this is my next step.
Oh, go ahead, Jeff.
And then we'll get to yours.
Okay.
So when thinking about the gateway, these are the suggested next steps after the webinar is over and what to do to get ready. So submit your registration form if you're not already registered in the Grants Gateway. Again, that could take up to a week maybe to get everything together. Sign up for notification in the Grant Opportunity Portal. I'll show you that in a few minutes when I get into the Gateway. that will alert you the moment that we post the grant opportunity on March 5th. We're saying 9 a.m., but it could be 8:55, it could be 9:07, you know, so you'll know right away when that happens. Once you get registered, you'll get 2 emails from our system. One is, here's your user ID, and the other is, here's your password, a temporary password. So log into the gateway. You can do that well before the March 5th date comes. Log into the gateway. You're going to have to save your organization information page. Even if you're an individual, that page exists. It's just got a few different questions. It's, you know, very simple to save it, but you do have to save that. That's kind of step 1 in the gateway. Next thing is create the new users, or a new user if you're an individual. Remember, that role would be the grantee contract signatory. If you're a not-for-profit, work on pre-qualification. So remember the dates of pre-qualification. You have to be pre-qualified at the date and time the applications are due. That would be April 2nd at 4 p.m. So you can submit your application way early, which we suggest you do, and still be working on pre-qualification. And as long as that pre-qualification is done before 4 o'clock on April 2nd, you're good to go. Again, that's only for not-for-profits. Don't worry about it if you're an individual. We're going to quickly go through the RFA in a few minutes. I'm only going to pull out a few things that I need to apply. We suggest you certainly review it, understand it, look at it, you know, have it as reference as you go through everything. And then we provide you, or Carolyn has provided you, the actual questions in the Grants Gateway. She's provided them in the RFA itself. So if I were you, I would start a Word document and just answer all those questions. Because when it comes time to apply, you're going to want to be quick to apply and fill out your information. And then between now and then, the 5th, or whenever you want to start your application, gather the required documents that you'll need. So we've gone through some of the things you'll need. You'll need some loan statements, you know, printouts from their website of your loan statements, the contract addendum, things like that. So get that stuff together between now and then. So there's a lot of homework you can do before then so that you're ready to get started. And again, the reason we say that is because this is first come, first serve. So those that have their applications completed and ready earliest will have obviously the best chance of actually obtaining these contracts. So let me go down now to Carolyn's last slide.
So this is just a rehash of the important dates that you need to have on your calendar to remember as you start to apply for the process. Most importantly, if you have questions, if you're reading this application, if you have questions after this webinar, please send us those questions. They are due no later than February 20th. The questions will come directly to me, and they should come through the Danny 2018 inbox. I then have a week to assess all your questions, provide all the answers, and post them on or about February 27th. So again, you're not going to get an email back from me specifically answering your individual question. What I'm going to try and do is categorize the questions, group them together so that I'm providing an answer that is meaningful for anyone reading the questions. You know, please do not send me a question that says, here's my exact scenario, here's all the specifics about my employment, my start dates, and my employer name, and please tell me if I'm eligible. I'm not able to answer that type of question, but what I'm able to say to you in return is, you know, these are the eligibility requirements that you must meet. Here are the questions that you have to be able to answer yes to ensure that you qualify. And so I'm going to do my very best to clear up anything that might be cloudy for people as they go through the process. The submission start date is March 5th. And again, sometime that morning, the gateway will open. You'll be able to start your application. You know, do not panic. I don't want you to think that you have to have it done in the first or second day to be eligible. You know, there's plenty of time to apply. However, it is first come, first serve. So I would say do your very best to get your applications in as soon as you can, and make sure they're as complete as you possibly can make them. You know, we don't want to have to go back, the reviewers don't want to have to go back and ask you for 20 different items that you missed. They really want to be able to address just few issues that might need to be tweaked, but they will be reaching out to you. They will review that application, let you know how it looks, what we need from you. Again, please be checking your email address so that you're aware of that communication coming your way. and be diligent about responding within the 10 business days time frame. And please respond in one email with all the information being asked, with the answers to all the information being asked. The submission deadline, the date and time that the gateway closes is April 2nd at 4 o'clock. So at 4:01, the submit button will disappear. If you're waiting to the last minute and you call the help desk and say, I can't click submit, they're going to take a look and say, it's because it's past 4 o'clock. So you need to be aware of that. Again, we try so hard to make this process as easy as possible. I know many of you are individual physicians, your time is limited. The process can be confusing, but we're not able to change anything about the fact that we have to use the gateway. So the way that we get around that is giving you this application in advance, letting you read it, knowing in advance what all the questions are going to be, all the information that you need to provide. There was a question about, how do we know what the attachments are? If you go to our homepage, our Danny department website, the RFA that's posted there includes all of the attachments we're asking for. So it shows you the list of rural counties and towns. It shows you the document that you have to attest to and how to answer. Most importantly, it talks about the addendum, what has to be included in the addendum. There's a list there. You can print it out. You can give it to your employer and start preparing that addendum so it's ready to go. There's information on how to identify your underserved area. Go there, fill it out, have it done in advance so that you have no doubt in your mind. And between now and the 20th, if you have a question, send it my way. Your reviewer is your friend. When they reach out to you, be responsive. And we're here to help you in any way possible. There are no trick questions, and we're not trying to be evasive. So we're really here to hold your hand through the process. Please use every tool that you have. And again, I would encourage you that even if you're not submitting a question, I would encourage you to read the question and answer document because it might provide valuable information that you had not even thought of.
Yeah, and I should have added in my next steps that periodically check that up until March, the date that she's going to provide the answers. But if there's ever a new question or answer added, it'd be good to make sure you're up on that. So before you submit it, at least one time check that Q&A document prior to March 5th or on March 5th. I'm going to first show you the grants management website. So that is right here, grantsmanagement.ny.gov, and that is our kind of help website. Ignore the stuff on the top. I'm an admin of it, so it just shows me how to edit it. But for you, what I would do is come here and go to Get Started. So the main page has some information about the Grants Gateway itself, links to all the other things that you'll find in the menu on top. But the most important thing to get started here is get started and register your organization. So this walks you through all the instructions on how to fill out and submit the registration form, where to mail it, and here's a link to the registration form. If you go down here, there's more links to the form and the other supporting documents we need. We do say, we need 5 to 10 business days to do this. In reality, probably doesn't take more than 3 days if you need an SFS number, but I will say it's very busy right now, and of course you want to get started as soon as possible. So there's the form to download. The substitute W-9 form is linked right here, and then we do need from a organization an organization chart, or from an individual a copy of your resume. And you get them notarized, just the registration form, get it notarized, and mail it to this address here in Albany. So here's the instructions, goes through every field, and down to the bottom here is the forms that you can download again. All right, so that's important there. We do have access to our manual. Carolyn has said that's actually an attachment in attachment number 1 in the Grants Gateway application itself. But if you wanted to, that's under training and guidance here. You can see we have for grant applicants, we also have an FAQ. So I'm not going to navigate through here, but it's pretty easy to navigate through our website to get everything you need. I just will point out that manual, which, yes, is 236 pages, I believe. You can find it right here under documents. So you can see I went to training and guidance for grant applicants, and then to documents, and from here we can get to the manual. Right down here. All right, so those resources are available to you now and always here on the Grants Management website. We do have the help desk. We really want people to go to the website first because a lot of questions we proactively answer in the FAQs or whatever. But if you're stuck, certainly, excuse me, give us an email or give us a call. You can see the contact information right here as well. So let's go to the Grants Gateway, and that is at grantsgateway.ny.gov. Now, I like to point this out because some people have a habit of typing in www when they go to a website, and that will not work. You can see it brings us to this error page that says this site is not secure. It's not a problem with how we did anything. It's just the way the state does it. They don't put the certificates on the www version of their websites. So just make sure you're not going to www. You're just going to grantsgateway.ny.gov, which will automatically bring you to the secure site, https://grantsgateway.ny.gov. Now, if you had a login, right now you could go in and log in, but I'm going to show you how to find the grant opportunity first. But actually, before I do that, there's another link to that registration form right here on the bottom right. And here's where I told you to, you should sign up for notification just to get that email when we post it. Now, you don't have to. You can just check at around 9 a.m. on the 5th. But if you wanted to get an email, you could click on Sign Up Now, fill out your name, organization, email, and select, I forget what it is. I believe it's under Health Services. And you can select whatever you want here and sign up for it, and you'll get an alert when we post it on that morning. So that was from the portal, and that was notification. Now, you can browse or search for grant opportunities. I'm going to click Search. And if you search, you can just search for the word doctors. You don't have to type the whole thing out, and hit Search, and you'll find it. Now, keep in mind, we're looking right now in the Live Grants Gateway. There's a couple things with the word doctors in it. That's just the previous years of Danny, really. But only one of them is clickable. Now, it's clickable now just to look at it. But on March 5th, it'll be clickable to apply for it, but you do not apply through this step. This is another thing that catches people. They think they go to the portal and find it and start applying. No, that's not how it works. So just remember, what I'm about to show you is just to find out about it and just to get the RFA, not to actually start your application. That'll be in a few minutes. So we're going to click on it. Some information about it. Yes, it looks weird. Because there's some wide text, it expands past the width, and nothing we can really do about it. But anyway, you can see there's Carolyn's info and that email address she's been talking about. The profile is just a few paragraphs about the opportunity. You can see there's a link here, or at least a link you can copy and paste. And we're just explaining, realize this is a non-gateway opportunity now while we're just giving you the information between now and March 5th. Then it will become this grants gateway opportunity that you can apply for starting on the morning of the 5th. On the right is some of the information we've already provided you, due date and time, the amount of money that's available, approximately 75 awards. If you divide 9 million divided by 75, or divided by 120,000, you get the 75. Other information here. And this is what drives that email. So actually, let's go back. When I told you to sign for health services, that's not it. Sign up for education supports and or workforce development, and that will target that email to you. And the other thing here is the actual link to the RFA. That's this right here, View Grant Opportunity. We click on it, and the PDF will download. And I'll just take a quick look at it. So it's 37 pages. And we certainly want you to read it all, understand it. And you can see it says for information only right now. When it goes live, it'll be kind of the real one. So maybe there'll be a couple tweaks between now and then. Just realize that the one that we're going to release on March 5th will be, you know, the one or the most current one. So table of contents here talks about who's eligible. A lot of things Carolyn went through already. I'm going to skip down, and I'm going to go down to what section do I want? Page 25. So down here and starting and completing the application. So in section 5 here, we've got The pre-submission upload. So what we talked about in the webinar, we also have here. Obviously, they're not linked here, but if we go through this document, you'll see them. And here are those questions. So remember I said in my next steps, I said you should get your questions together and answers together before the 5th if you want to, kind of be one of the first applicants. And to do that, just start a Word doc and fill out your answers to 1A and your answer to 1B and 1C and so on. So this is going to give you all the questions that I'm about to do in the gateway itself. Section 2 or Part 2 is identifying the physician. So if you're an individual, you would have filled out Section 1 and Section 2 basically the same. Section 3, we talk about the facility. So these are all the questions I'm going to answer in a few minutes. But it's a good idea for you to just get everything together ahead of time to know, one, am I going to be able to do all this? There's no point in going through it if you realize, well, I can't, that one part doesn't apply to me, or I can't answer yes to that, or whatever it is, and maybe you're not going to be eligible. So it's a good idea just to go through the questions itself before you apply. So I wanted to point that out, and then I'm just going to skip through this because we're going to go through these questions. It does talk about the work plan. Remember, Carolyn said there's specific text you have to provide, and we have that here somewhere. The counties of service and the medical specialty in the project summary, and then NA in that organizational capacity box. You'll see that when we go through it. And then the budget, we give you the text to put into the budget as well. And information here on the budget starts on page 31, or 33. All right, so and actually right down here in D is what we want you to actually type in the gateway itself. So when I come back, when I go into my application, I'm actually going to come back here and just kind of copy and paste. So we've looked at the RFA, and now we're going to get into the grants gateway. So I'll leave it open just so I can reference it. Now again, remember, I did not log into the gateway, and in this case, it's prior to March 5th, so it's not actually available. So let's say now it is March 5th or a day after, and we can log in. So I'm going to do that in our test system here. And I'm going to log in. Now, I'm not actually going to be an individual. I'm going to be someone that works at a not-for-profit, but it would be the same if you're an individual. You would go to the login button up here in the top left and type in your username and password. Now, if you forgot your password, but you know your username, you can click on Forgot Password, and we can generate you a new password by filling in your login and your email address. But I know mine. I'm going to have to change it. So the first time you log in, it'll either say, maybe it's been a while, 90 days, and it'll tell you that it's expired, or if it's your very first time, that temporary password automatically expires, and you need to go down and change it. Now, ignore on the bottom here, I belong to 2 sample organizations in our system. Chances are you'll probably only belong to 1 organization. All right, so I've saved my organization. I've saved my password. Now, remember I said those delegated admins will have to go in and work on the organization page. So mine has already been saved, but if I did click on organization up in the black bar, and then mine is called sample organization, this is the page you need to fill out. So there's only a couple questions. You can see I didn't do it, and it's going to give me an error if I tried to do anything with it, but organizations would have to do it. If you're an individual, obviously it's not going to ask you how many, what's your current operating budget and how many staff you have and so on. So it's a little different for a individual. All right, so let's say you've got your account set up. Just so you know, I can't do it because I'm not a delegated admin here, but to add members, you would go to organization here, organization members, and then that user would have a add member and new member button. So you would add members and new members. So the path is organizations, organization members, add member, new member. So that's in the manual. That's in many documents that we have to help you get through that. All right, so I've logged in. I've logged in the type of user that can start and save and actually submit an application because I'm a contract signatory, and I want to look for that. So remember, you don't go back to the portal. The portal is just to find opportunities, not to actually start to apply. So I click right here on View Opportunities. My organization type means that there's 334 opportunities out there that I could apply for. In reality, I only want one of them, so I click on View Opportunities, and I do what I did before, and I search for the word doctors. And I hit search, and there should only be one thing available now after March 5th to do this, and I can click on it, and this will look exactly like what we saw, except for I now have a button down here to apply for the grant opportunity. So I will say, checking on that Q&A document, that'll be right here. That'll be also, if you went through the portal and searched for it, in the same place, the link will be right here. And as Carolyn said, it'll be on the Danny website as a subpart of the Department of Health website starting on the 27th. All right, so yep, I want to apply. I click on Apply for Grant Opportunity. Before I do, I just want to mention, remember she said that you can apply up to 4 times if you are an organization. It will actually show you 3 applications started, 2 applications started. It'll let you know how many, and that's why she said if you get to 4, it won't let you do any more. So for me, it's not going to because this is my very first one. So I'll apply for the grant opportunity, and it's now started my application. So the grant opportunity ID is this number right here, DOH01 DRPLR7 2020, and then this is application number 1. I'm the first person to start an application. So if you ever call our help desk and you want to refer to the application number, that's what we're asking for. Essentially, you can just say DRPLR7 number 1 or number 17 or wherever you happen to be. All right, so you can see a few things appear now. I've got these green buttons. The Forms menu is where I'm going to be spending most of my time. This Details button you can see kind of opens and closes and shows one thing that I think is important is the current status. You're in application in process right now, and eventually we'll submit it, and that'll obviously change that status. So the main page just shows your project title, of which I have nothing, your grant funds, and your total project cost. Obviously, as we start filling things out, we'll get that filled out. Okay, so Forms menu we're going to spend most of our time in. Status changes, I'll end up submitting the application. You can ignore management tools, and you can ignore progress reports and related documents. So let's go to the Forms menu. You notice when I hover, it pops open the menu. Don't bother doing that. Just click on the word Forms, and that'll open it up for you. All right, so these are the forms that you have to fill out, and the questions that Carolyn showed you, or that we showed you in the RFP, are right here. So the sections, contract document properties, you can ignore that. If you click on it, all it is an example of what a master grant contract looks like for the state. If you're wondering what are you getting yourself into, there's the 25 pages of state terms and conditions in there. There's the attachment A1, which is the program-specific terms and conditions. And there's the attachment M, which is the MWBE document. MWBE is a state program for minority and women-owned business entities. So that'll give you information about that. A lot of that obviously doesn't apply if you're an individual. So these are just FYI, if you wanted to know what documents make up a contract, that's right here. So you can ignore it if you would like. Print application will allow you to see it all on one page so you can see what your answers were. We'll do that later. Another link to the RFA. It says RFP, but it's the RFA. And then application versions, about 5 or 10 minutes after you submit your application, a nice, easy-to-read PDF will be created here. That's what the reviewers at Department of Health will look through to actually review your application. So you're going to get started in filling out this information here, project site addresses, the program-specific questions, here's the budget section, then the work plan. And then the pre-submission uploads is right here, and I'm going to skip to that right now just to show you those attachments. So remember, these attachments were mentioned in the RFA. In fact, you know what? I skipped over that in the RFA. Let me go back there quickly. So they are here, mentioned here, and then available on the website and available in the Grants Gateway. Okay, so here are those pre-submission uploads. There's that manual. Click on it to download it. You don't need to provide anything for us. Attachment 2 is site information. So if you have three sites in the Grants Gateway program-specific questions, which I'm about to do, and you have a fourth, you would enter the fourth site information here, and we give you a template. So if you click on this click here and open it up, this is a template to fill out for the site information. So this is only if you have more than 3 to provide. Next is loan statements. So it shows a template, but really all it is just, I think, saying, hey, you need to upload your loan statement. Okay, so it gives you some instructions here. This is obviously not the thing you're going to upload. The thing you're going to upload right here is loan statements, attachments. Now, the Grants Gateway, this section, the pre-submission uploads, only allows for 1 attachment in each one of these sections. So if you had multiple pages, you do need to combine them into one PDF, and we really prefer a PDF. An image document may fail. Doesn't mean it's going to fail your application, but it may fail us from being able to see it and cause more work for you and us to get it. So make sure you do it as a PDF. I'm going to promote a website that we use, which is called smallpdf.com. And if you don't have PDF Maker, it'll allow you to combine things together and allow you to make a PDF smaller if the file size is large. So that's smallpdf.com. It's actually blocked here now for us to use, but we used to use it all the time. And it's a good site that is used it's very popular. Anyway, I have no affiliation with it. Next is attachment 4, the consent to disclosure. So we talked about that, and here's that form. You click here, and you would fill it out. You would sign it, and you would then scan it, and you would go and attach it here. So why don't I start doing that as we get through? So the consent disclosure, I click on Browse, and I go and find the document that I meant to include. I'm just going to include this sample attachment, so my attachments are not going to really mean anything. Yours obviously will be real. The employment contract or business plan. So remember, you have a business plan or the contract that you have to show, and that shows the dates. And if I click here, this talks about what we need. And it also talks about that addendum information. So these are those bullet points that we talked about. And it's not, again, that you need to have 1 or 2 of these, but all of these will be addressed. So you might as well just take this text we give you and fill in the name and fill in the blanks as required. So if this stuff isn't covered in your employment contract, which probably it isn't, this addendum should be added. All right, so you would fill out a document, you would attach it to that contract, and then you would attach it here into the pre-submission uploads. So there's the tool to identify an underserved area. Now, I've been talking here for a few minutes. We've been on this page for a few minutes, but I haven't hit save yet. And I want to make sure that you do that because, as was mentioned earlier, the system will time you out after about 20 minutes of inactivity. Now, it's only been 5 or so, but just to be sure, I'll hit the save button. So I did hit save, and it gave me an error because there's 2 of them that I missed. Obviously, I didn't just get to them yet, but the system will save the things you have attached. For instance, this consent to disclosure that I filled out, when I click on View File, that's the document I provided here. So if I click on View File, this is just going to be my sample document. But in your case, that would be the real. Continuing through here, I've attached my business plan. So that tool to identify an underserved area. So here it is, to be uploaded by the applicant as attachment 8 along with supporting documentation. So this is the tool, this is another tool, and this is the supporting documentation in number 8. You can see that's the one we require you upload. So the tool is right here in number 6, which I'm not going to go through, but this will help you understand it. Let me close all these. And then there's the number 7, rural counties and towns, which the state have identified as rural counties and towns that are eligible here. So these are the counties, and these are the towns in each county. So that'll help you identify. Whenever you do, this is your supporting documentation right here. So there's instructions here under this document template. So it's telling you what to do here, and attachment number 8 is where you have your proof, your supporting documentation. Again, if it's more than one document, you need to combine them into one PDF and then click on Browse and attach it. Now, I'm saying the word browse. If you're in another browser, Chrome or Firefox, I believe the word is choose file. But I want to point that out because there's one part of the gateway that you really do need to be in Internet Explorer 11. Actually, in your case, it maybe won't matter because it's the work plan, and the work plan is already filled out for you. But we do really suggest that you use Internet Explorer 11. You'll see that's in the RFA as well. Other browsers will work. There are problems on the work plan section in other browsers. Now that I think about it, I don't think it'll affect you because of the way this particular work plan is laid out, but we technically only officially support Internet Explorer 11. Then there's an attestation and authorized representative, and again, a template. Okay, so there's that authorization form. So you would sign it, you would fill it out, sign it, and then attach it here. And then finally, the vendor responsibility attestation, which is certain applicants need to do that, not-for-profits have to do that, and there's more information about that here and in the RFA as well. So remember these last few I didn't hit save yet, so I'll hit save up in the blue bar. And you can see no more red errors. I'm all set with that. Now, there's a delete button here. If I hit delete, that'll delete every single thing I've done here, so don't do that. But let's say, oh, this is the wrong document I provided here. You can just click on Browse and save over it, that's all. So there's no deleting, it's just saving over something that you've already added. All right, so we're doing it out of order because those attachments are referenced when we get into the questions. You don't have to do it out of order. You can go in order here. So the first thing, remember what we did was we went to the Forms menu, and we skipped all the way down here to the pre-submission uploads. But now I'm just going to go in order. So project site addresses. So I don't really know. I'm not being too creative here. So I'm just picking an address, 123 Main Street. Now, we don't really care about regional council. That's a drop-down here that you can provide, but we don't really look at that. But we do need you to fill out agency-specific region. This helps us with that percentage that we need to hit, New York City and rest of state. So in my case, I'm picking rest of state. And I'll hit save. Okay, so if you have other addresses that you're going to be working at, remember you can have 2 or 3 other locations. We don't need them here. Nobody's going to look at it here. Don't bother. There's actually not even, there used to be an add button for some of them. I should have noticed that. So there's no add button. So all we need is your primary location right here. Your other locations, if there are any, will be answered in the program-specific questions. So let's do that. We'll go back to the Forms menu, and we'll go down to the program-specific questions. Again, these are all those questions that you've already seen in the RFA. So the project title is the Physician's Loan Repayment Program. And then we'll just go into your name or the name of the applicant. So remember, the applicant might be different than the physician, but if you're an individual, it certainly is the same. Your address, the name of the contact person, your phone number in this format, the email address, the status. So you need to pick one of these. Are you a not-for-profit or are you a for-profit? And if you're an individual, you're considered a for-profit. So I'm just going to write for-profit. Now, question 1G, you have to indicate the type of applicant, and only one of these applies to you. The applicant named above must match the type of applicant selected below. If your physician is an individual physician applicant or 1H, a healthcare facility is either a 1I, 1J, 1K, or 1L, you are not eligible unless you can answer yes to only one of these. There would be no reason why you'd be more than one. So to make it easy for me, yes, I'm an individual physician, which means no, I'm not a healthcare facility. I'm not this, I'm not that. But if you are working at a facility that's applying on behalf of somebody, you need to answer these as applicable. All right, now we have the actual person, the physician identification. So here's their name, here's their title, their mailing address, their phone number again, I'm just going to go quick through some of these. Email, their specialty, NPI number. All right, now we get to the facility. How many different facilities will this physician be working at? I'll pick 2. So here's the name of it. I'm just going to start typing. Here is my answer. You will not be doing that. So the address, the county, the region, New York City or rest of state, the type, so it is we give you some options here, but tell us the type of facility it is. The, what is this, DOH, OASIS, or OHM operating certificate number, percentage of time, let's call this 60, and is it HPSA? I'll say it's either yes or no, and if so, there's a number. If there's a second facility, go ahead and answer it. Otherwise, you can see, we just say type in the word none. So I'm going to just fill out these just because I have a second one, let's say at 40%. Same questions. And then, is there a third? Nope. So I'll type none here. And now 3U is not required, 3V is not required unless I have a third. All right, so we get to 4. So 4 is the use of funds. Identify what the Danny funds will be used for, and you must select only one, yes to only one of these. So in mine, it's a physician to repay outstanding qualified educational debt. So it is not to establish a joint or join a medical practice. It is not to retain or recruit physicians. Part 5 is the minimum requirements. The physician who's completing the Danny service obligation is eligible to participate in this program if they can answer yes to these questions. So question 1, is the physician a U.S. citizen or permanent resident? So I'm not going to read all these. I think you can understand them, but you need to answer yes to all of them if you are eligible, or to be eligible, I should say. Talks about the dates, and we asked that before, and people had asked that in the questions, no earlier than April 4th, 2019. Again, the idea for that is, or the reasoning behind that is, we want new people, new physicians to be working in underserved areas. Start date, November 1st. So you certainly can be at that organization prior to November 1st, but your Danny obligation date starts on November 1st, 2020, meaning your 3-year clock starts then. Okay, so now question 5Q. The physician who is completing the Danny service obligation is eligible to participate in this program only if the applicant can answer no to these questions Q through V. So is the physician in breach of health professional service obligation to the federal government, any state or local government? No. So you should be answering no to these. If you do answer no to these, you are eligible. Next is the physician current status. So are you currently licensed? If yes, provide the license number. If no, provide the date. You're resident. So again, you can answer these as best you see. Part 7 is other scholarships and loan forgiveness. You will answer these as best you can. Part 8 is the other statement verifications. So these are things just to make sure that you realize, remember what you're doing, that we strongly suggest that you submit your application early because we're not going to accept late applications. There's no excuse that there's a technical issue. There aren't generally technical issues in the gateway that are not caused by the applicants. So these should all be yeses. So yes, I understand it's due before or by April 2nd at 4 p.m. All right, so I'm answering that. Yes, I understand late applications are not allowed. If I'm a not-for-profit, I must be pre-qualified, or I know it doesn't apply to me. Still answer yes to that. And what are we asking here? Under penalty of perjury, that the applicant has implemented a written policy of sexual harassment prevention in the workplace. So that's a New York State law. For every contract that we do, there has to be a sexual harassment prevention policy in place. And then it says, here are the directions for the budget, and here are the directions for the work plan. Also in the RFA, but we're going to go and click Save here. Now, you may have hit Save several times, and I hope you did as you were going through here. And I purposely missed one of the questions, that was 3CC. And the reason is the system will not let you submit your application with that error. So I'm going to pretend I don't notice that, and when I go to submit it, we'll get an error that says, wait a minute, you didn't answer question 3CC. So it does save as you go along. All those other things have been answered, but when I get down to 3CC, you'll see I forgot to answer that, and I left it blank. All right? So we're done with program-specific questions. Now remember, you don't have to do this all in one sitting. You could leave and come back if you want to. If you were to log out and you were to log back in, you'd be back at your home page. And now on your page, you have a My Tasks, because an application that you start becomes a task. So I could get back into this by clicking on Open Tasks and clicking on my application number 00001, or I could search for it up in Applications, and I can say, you know, show me all applications with the word doctors in it that I've started, and there happens to be only the one. So you can get back to it either one of those ways. Easiest way, obviously, is from the home page and My Tasks. So now I'm back to the main page, and let's get into our Forms menu and then the budget. So we do have an error here. Remember, we missed that one question. That's okay. And if we go back to the RFA, I want to go to that budget section, which I believe was page 34-ish.
Yeah. Now you gotta go back up.
So here's what I'm going to be writing in the expenditure budget, and it's going to tell me what to put in here somewhere. Where was it?
It's up a little bit higher.
Is it?
Yeah, because this is.
Ah, right here.
Yeah.
So other expenses, I'm going to write repayment of educational loans and then repayment of educational loans. So I'm just going to copy that. So back in the gateway, I go in here. I don't have to do personal services salary. I don't have to do fringe, contractual. If I was an organization applying, some of these items might apply to me. And just for instance, I'll show you how to fill one of those out. Contractual. Here's the description, justification, and the grant funds. Let's say I have $20,000 here. And let's say I have a second contractual item. Well, now that I've hit save, I have an add button. I can click on add and put in another item. And let's say this one is $15,000. So I could go through, if I'm an organization, I could go through and add what's necessary for things that are allowable in my application. I'm not, though. I'm an individual. Let's hit delete here. Normally you wouldn't do this, but I'm deleting this page because I don't want to have something in the contractual section. Okay, so now if I go back to the Forms menu, it will look like my budget has not been touched, although it has. Let's see, did I leave that one? Yeah, let me delete this as well. So if you're an individual, you'll come to the Forms menu, and you'll go down to the Other section, Other Expenses Detail. And remember, we gave you the justification, repayment of educational loans. We gave you the description and justification, and then the amount. So if your loan exceeds $120,000, you're going to type in $120,000 because that's the most you can ask for. If your loan is less than that and you want help paying off $111,000, or 110 in my case, you'll type that in. All right, so I'm going to put in for the total amount, 120, and hit save. So obviously we're not giving you $120,000 up front. This is $120,000 over the length of this contract, which would be that 3-year service requirement. All right, so that was the other expenses detail. Let's go back to the forms menu, because we also want you to fill out the narrative. So this is a narrative for the other section. So we click on narrative, and remember we gave an answer here what to fill out in the RFA. So let's go back to the RFA, and in the narrative we write, indicate the total funds requested per year. So you can simply write requesting, or just write 40,000 per year, or, you know, here's the total and it's X per year. So we want to know how much you're requesting per year.
It is important to note that we will standardize the amounts given out each year. So we'll take the total amount you're requesting and divide by 3, and that's the amount per year. So it's uniform, the amount annually that's given out. We would not give you $40,000 in year 1 and $30,000 in year 2 and $20,000 in year 3. We're going to just simply take the total, divide by 3, and that is what you get annually.
So that was the narrative. Now, notice though, the narrative is not a required field, but we do want you to do it. So make sure you remember to do that. The system won't remind you if you've missed that page. And finally, in the budget section, you have to go to the expenditure summary page. There's nothing to fill out, but the system makes you look at it before you submit your application. So we click on it, and we look at it. Yep, that's what I asked for, $120,000 in grant funds. You can ignore the other things here, and that looks fine to me. All right, last section is the work plan section. Back down to the forms menu. Again, everything is done here through the forms menu. And we're going to go back down to the bottom and to the work plan. And there's 2 parts. The overview form, where if we go back into the RFA, we give you the information to fill out. Is it before?
Yeah.
I wrote it down here, what page?
Here.
Okay. So click on the objectives and tasks, review the information. The summary, though. In the summary section on the grants gateway, applicants are instructed to enter the dates of service on the contract period. So that's 11/1/2020 to 10/31/2023. So we'll go back to our application. That's right here. 11/1/2020 to 10/31/2023. And then the summary, if I go back to the RFA, we're going to add the county and medical specialty. So you'll put it there. And then organizational capacity, just type NA. This is a required field because of the red asterisk, but we don't look at it, so we just want you to type NA there. And hit save. All right, green arrow, green light, that's good. And the last thing is just to look at it. You don't have to do anything on it. I'm back at the forms menu. I go back down to the work plan and now to the work plan properties section. This is the page that I told you has errors if you use Chrome, but because it's all grayed out, because you can only look at it, that may not be an issue. Still, I would use IE 11. But these are the objectives, tasks, performance measures you will be adhering to if you get a contract. All right? So I can go back to either forms menu or main menu, doesn't matter which one, because I think I'm done right now. And if I go back to the forms menu, actually we can notice now this is filled out on this page. If I go back to the forms menu, I'm going to pretend I don't notice that one error. But I've done everything, and if you didn't do it in order, you would have already done pre-submission uploads. If you are doing it in order, this is now the last page. The grantee document folder you can ignore. That's kind of like an overflow section if you have any other documents to provide. We're not asking you to put anything in there, so please don't. There might be some circumstances where you need to. You'd kind of have to check with us first, but we don't want it there because everything we require is going here in pre-submission uploads. All right, so I'm ready to submit it. If you remember, the status that we're in is in application in process. It's due on 4/2 at 4 o'clock, and let's say it's well before that. And I go to the status change option, and I click the status of application submitted. And it says, wait a minute, you missed 3C, or 3CC. So I can click on it here and get right back to that. So this is the kind of thing where we don't want you to wait until 3:59 and 27 seconds to do it, because by the time you go through it, you might miss the deadline. And I go here, I forgot question 3CC, and I'll go down to it. And is there a fourth facility? No, there isn't, and I'll hit save. Now I believe I'm done. And now if I go to status changes, remember again, we're in the status of application in process. And if I go here and click on application submitted, apply that status, no more errors, and it says in agreement, essentially saying, yes, I'm allowed to sign on behalf of the organization that I'm logged in as. I haven't given my password away, and I'll click on I agree, and it is now submitting my application. And we're done. Application has been submitted. How do I know? A couple ways. Number one, the status here, if we click on details, has now been changed to assignment of reviewers, and there it will sit until after March 5th, and then they'll start reviewing it. Another way is that I will get an email in a few seconds that says, congratulations, you've submitted application DR PLR 7 2020-00001. Another way is, remember I had a task before. If I go back home, that task no longer exists. In fact, I have no tasks, but I still can find it. That's fine. I can go up to applications, and I can search. It actually remembers the last thing you searched on, and I can click on search, and I can see, oh yeah, here's that application number 1, which now happens to be in that status of assignment of reviewers. Now, the last thing I want to show you is something that I said might take 5 or 10 minutes to do. So if it doesn't come up here now, not really a big deal, but we will answer a few questions and then look back. And that's in the Forms menu, and I can see it's not there yet, under Application Versions. This is where that PDF will be created. That will include your entire document. Now, what I should have said before I submitted, and what you might have wanted to do before you submit, is do this print application. That actually lets you review everything kind of in one page. So if I click on print application, you would do this before you submit your application. I don't really want to print it, I just want to look at it. You can go through and see all the answers you provided. And you want to make sure there's no typos, or you know, you only put in your first name or the word name instead of your actual name. So you want to just use this to double check. Now what it won't do, if we scroll down here, these are all those answers all those questions I answered. But what it won't do is give me the attachments I provided. So it'll go through all the sections of the budget. Of course, I had nothing in personal services. I had nothing in contractual, travel, and so on. But I did have something in other, something called repayment of educational loans, you'll remember, for $120,000. And I did have the narrative, and I just wrote this, requesting $40,000 per year. There's that expenditure summary. Here's the work plan. Now, you'll notice the work plan does not show here the objectives, tasks, performance measures. It's just the way that it works. No need to get into details of it, but you saw the work plan anyway, and it's in the RFA, and it's nothing you could have touched anyway. And then finally, we get down to those attachments. So the attachments, it lets me know that I did upload something, for instance, in number 4 here, but I can't actually double check what I did. So if you wanted to double check the attachments you provided, which I strongly suggest before you submit your application, you would go down here, back in the Forms menu, back to that pre-submission uploads, and when it comes up, you'll see View File. These are all the attachments I provided. So if I wanted to double check, is this the right document I provided? And I click on View File. And obviously, it's just my sample attachment, but yep, that's the attachment I intended to upload. So I would strongly suggest you do that before you submit the application. But now that we have submitted the application, let's see if I stalled enough to see if that application PDF has been created. And it has. So here it is under application versions. So this is just optional, you don't have to do this. This will be saved here kind of forever. And here it is, here's that application I submitted, application number 1, and it actually shows you the date and time and seconds that you submitted it. So if I click on it, this is everything in a nice, easy to read format. Mine happens to only be 25 pages. Yours will be longer because you'll have real answers and real attachments. But the name of my organization, my application number, the amount I'm requesting, who submitted it and when. Page 3 is just that address, that main address we gave. And then finally, we get into the meat of it, the questions and our answers that we provided. So all those questions and answers. Then our budget, $120,000. This should all look familiar to you. Then the details of the budget. There's that negative, $40,000 per year. Work plan. Now the work plan does show the NA for the organizational capacity, and then finally all the attachments we provided. Mine are just placeholders that say sample attachment. Yours would be the actual attachments you provided. All right, so that last part, looking at your application, which is here in application versions, is not required, but just FYI, that's where it goes, and that's what your final application looks like. All right, so we're done here, right on time, so that's good. And I know there's some other questions that came up. I'll answer those, and then Carolyn may have some kind of closing remarks here, and then we'll be done.
The one thing I'll say to everyone as before anyone starts to sign off is again, the highlight of what you need to do, get your Grants Gateway application now, or get your Grants Gateway sign-on now. When those questions and answers are posted, make sure you read them. Then get a hold of the RFA, print the RFA and all the attachments from our department website. Fill them out manually on paper. Know what your answers are going to be in advance. That's the easy part. They're all, as you can see today, yes, no questions. Some of the attachments require a little bit of work to get them ready ahead of time. And that way, when you get ready to apply, when the application opens, you have everything in front of you. You're not scrambling for answers to any questions. Remember that the Grants Gateway is there with a helpline if you are having difficulty finding the opportunity when it's published, or if you're having trouble signing on with your user ID, keep that handy. And please send me any questions in writing. That's the easiest way to get a hold of me. Please try not to call because I can't speak with you directly about your inquiry. The best way to contact me is via email.